Dr. Vicki is a veterinary behaviourist. She is a full member of the APBC. I don't know if you still work for the PDSA as well.
Yeah, I do some shifts for them as well. Yeah.
Wonderful. So the People's Dispensary for Sick Animals are a wonderful charity, so check them out as well. Vicki's working towards her RCVS, Advanced Practitioner Status in Clinical Animal Behaviour, and graduated at the top of her class in 2013, so she definitely knows her stuff. She also does talks with the APBC as a veterinary behaviourist, because there's not many veterinary behaviourists out there. So thanks so much for Vicki today to talk to us about cats. How are you today?
I'm very well, thanks. Yeah, it's a definite slight change in the weather. We've suddenly started to get a lot colder than it has been, but yeah, no, delighted to be here and hopefully offer some points that can help people identify when their cats are in a bit of pain.
Yeah, because obviously cats are prey and predator species, so they don't show pain, as readily as dog perhaps, because it's not ideal for them to look vulnerable. But for cat owners, guardians out there, can you recommend anything that they should be looking out for?
Yeah, absolutely. I mean, I guess if we kind of start with the most common one that we would see, which is osteoarthritis. So I think, cats can experience pain in all body systems. And I think we, as vets, always go to osteoarthritis as when we're thinking about chronic pain, not necessarily thinking about gut pain and irritation from skin. So if we start with the most obvious, and then we can kind of skip into those other little bits as well, because I think they're quite important to help owners be able to identify it. I think to start with, if you think there's about 90% of our cats that are over 12 years of age will have some form of osteoarthritic disease, which is quite a high proportion. When you think how long our cats are living for, it's actually quite 90% is really quite high. But I think, working in clinical practice, you don't see, so when a cat comes into a clinic to be examined by a vet, that whole process is exceptionally stressful, right? So before we even get them out on the table, even if you've got the best owner and caregiver in the world that's doing lots of desensitization, getting them as prepared as they can be, as you say, because of the nature of the species, they quite often either shut down or try and attack you. That's just generally how it goes.
Yeah.
So it's actually the best way of identifying pain, particularly osteoarthritic pain in our cats, is owner observation. So, and owner observation involves behavior change. And there's a lovely resource. Zoetis, one of the drug companies, has got it here. So it's just, I don't know if you can see that, but I'll pop it up. But it's an OA pain checklist. It's not one of the validated ones. There are those out there. But it is really helpful. I think I give it to a lot of my cat owners because it's a snapshot. So kind of looking at how are they climbing upstairs? Are they bunny hopping? Are they hesitant to come down the stairs? What are they like when they're chasing, a toy? Did they used to kind of run around and really engage in that? And now are they perhaps a bit more withdrawn, a bit hesitant? What are they like jumping up on a table? Can they do that anymore? Do they kind of, cats have an amazing balance, but quite often when osteoarthritis starts to kick in, they might miss jump and you'll kind of notice it because they don't normally do that. And, going up and down stairs, are they having difficulty going to the toilet? Sometimes they won't use the litter tray how they used to, and you'll find them urinating outside a litter tray or defecating. I think if they're pooing outside a litter tray, that's a big red flag for me that there's some osteoarthritic pain. So they're those subtle signs that we would see. And as vets, we're heavily reliant on the owners for communicating those things to us. So that's kind of my kind of synopsis of what to look out for with osteoarthritic pain. And the body's incredible with what pain can do to them, and it works in the periphery, it also works centrally, and then it can actually change. There's something called nociceptive, but it changes the perception of how we perceive pain, and that's really difficult to treat and to recognize. So Yeah, I mean, hopefully that's helpful. And behavior change, I think, is the biggest thing. So you're not looking for a cat that's lame. If they are lame, then that's an obvious reason to take them. But if they start to become withdrawn, if they're starting to change their movement habits, their urinating habits, their ability to access high resources, they love to see in 3D, jump up high and feel safe. And
Yeah.
if all of that's stopping and they're hiding and crunching down low, then that for me is a big flag that they might be in some discomfort.
Yeah. So you obviously touched on, is it vet behavior yourself? You obviously work with people whose cats are having litter box issues, and obviously there can be lots of different reasons for that. But osteoarthritis, just getting in and out of the litter tray, that might be painful. They might start associating pain with using the litter box.
Exactly.
Yeah.
Exactly. I think that's a really, again, cats urinating in inappropriate places is a common presentation both to a veterinary behaviourist and your general practice vets, because it's so obvious, and as you say, there are an array of reasons, but sometimes it can be a bit cyclical as well, because if there's a component of stress, then that can also add to and affect their urinary bladder health and all of those things as well. So, and there's things in cats called FIC, which is feline interstitial cystitis, which is again a whole different world, but that can be very painful and very difficult to diagnose as well. So there's lots of different things that could be going on when that happens. And I think one of the first things that most veterinary practices will ask for in that situation is a urine sample, and that's so challenging to get in our cats. There are litters that you can put down that allow it to not absorb, but again, a lot of cats really don't want to use those litter trays because suddenly they've got this foreign substrate in it, which can be really off-putting. So you have to get a little bit creative with that, and if you are struggling, then talk to the vet team and they can help you with that. But I do think that for anything like that, I would always be thinking, especially in an older cat, if they've not got any other kind of stresses or there's no real repeated history of constant urinary tract infections or irritations of that bladder lining, and it's developing later on in life, then osteoarthritic pain would be a big thing. And there's lots of things that we can do to help that. You alter how the litter box is presented, and there's even DIY ones can be really helpful, where you actually sand out and cut out a section so that they can really access it. And I don't know about you, but I quite often do that with some of my cat cases anyway, because they don't like the litter box. They don't actually like jumping in to go. It's not necessarily a natural way for a cat to access a latrine site. So yeah.
My auntie's cat, they needed to get a urine sample, and she bought the litter, I'm sure there's different brands, but cat core we're talking about, but he would not go, so she added extra litter, because obviously cats like to dig and cover it, but then because she added too much of the cat core, there wasn't enough urine to get a sample, because
I mean, there are ways in which we can actually obtain a sample through cystosynthesis, which is where we actually can go and get that sample. And that's one of the most accurate ways. And I think sometimes, if we have those cats that are doing that, it's potentially easier for them to come and have a sedation if that's necessary, depending on how the cat tolerates those type of things, and working around actually trying to make it as stress-free as possible for them, to kind of get the information that we need to work out what's happening.
Yeah, could you tell us a bit about that procedure, please? What's involved?
Cystosynthesis?
Yeah, cystosynthesis.
Yeah, so basically what we're doing in that situation is we're using a very small needle and a syringe, and actually going into the bladder to withdraw some of the urine. Okay, so there's positions in which you can do that. Some vets will sedate to do that, some won't necessarily, but you can put local on. There's lots of different ways of trying to do that, but quite often I would sedate and then do it that way, just so that they're not in any discomfort. But it's a nice way, and at that point as well, the vet might say, well, let's just get an image of the bladder, be it on an x-ray or an ultrasound, so that you can check that there's no urinary stones or any of those things that could be causing the symptoms that you're seeing, as part of the diagnostic workup.
So I know cystitis in cats can reoccur if they've had it once. I can, it can be something as simple as a cat walking past a window. It could be sometimes hard to diagnose what the stressor is.
Yeah, I think they're multifactorial, and iCat Care is a fantastic resource for cat owners that goes through all of that, like particularly with feline interstitial cystitis, because it's got so many different components to it. So it's got like there's potential changes that are actually happening in the bladder wall that can predispose those cats to be in that situation, plus external stressors, plus diet, and all of those things can contribute into what's going on into what used to historically be called stress cystitis, but we're kind of moving away and think of it in different terminology now because it is such a multifactorial disease with so many different components. It can be really challenging to A, diagnose it, and B, treat it. Yeah, there's lots of different things out there, and if they are worried about that, I always think that iCat Care is a great resource to kind of start. If you're going into the veterinary team and you think, oh, I've got all of these questions, start there, and then you can kind of take some notes and say, look, what about this? What about this? What about this? So that you've got clear questions, so that the vet then can just alleviate all those concerns for you. Because you generally don't get that much time in general practice to spend with your clients. That's why I love my behaviour stuff, because I can spend time with them. Yeah, in general practice, that's much more reduced. So
so for those people out there, maybe I don't know, they haven't worked with a cat behaviourist before, or they're thinking that they might like to. Could you tell us a bit about how your process works? Obviously, you're veterinary behaviourist, so you've got that added element of being able to consider the physical as well as the mental. So could you talk us through kind of what your process is?
Yeah, so I guess it's quite similar in terms of how non-vet behaviourists work as well. The first stage is a lot of information gathering. I think our tools for helping diagnose and work with feline behaviour cases are less than, if you think about in dogs, we've got a lot more of those kind of assessment tools that we can use, the PANAS and DS and all of those type of things. We haven't really got those yet in feline behaviour, but I quite like to kind of gather as much information as I can initially. I always ask for a floor plan, and I think that's always quite, not being a particularly great drawer myself, I always feel really guilty. So I always reassure clients, it does not matter if it's literally lines with straight lines dividing. You get all sorts. Some people that are obviously architectural geniuses that have all these like, this is this type of window, and no, just a very straightforward plan so that you can work out where the problems are. I think that's hugely important for inappropriate urination cases. And digression as well. So if you've got kind of multi-cat households, working out where the two cats are fighting. Quite often it's in narrow corridors or an exit point, or one's trying to get to the food resource and things like that. So I think that is a huge resource that I really like to have. So and mapped out as much as I can. So where their litter trays are, where their food is, where their water is, because sometimes it's as simple as actually their food bowl and their water bowl are quite close together. And cats, and I didn't know this when I was working in general practice, this is only through doing the behaviour work, they need separate, and that's such a simple, lovely way to be able to go, actually, do you know what, guys, let's just move this and see. So quite often I will ask for that floor plan, and if there is something that can be tweaked straight away, I would suggest that, potentially before. And then I always ask for the medical history from the veterinary team as well. And it wouldn't just be from the one cat. I think if there's a multi-cat household, then you need all of those medical records, because again, quite often there'll be things that are going on. And then it's a similar process in that we meet, we go through potential reasons, what are the emotions potentially driving this, and with cats, it's a little bit different. I don't know how you feel about training cats and things, actually teaching them behaviours that you can counter condition. I've got no experience with that. So mine is, environmental, and then I can point people in the direction if they're keen to do that. Have you ever done it?
I've done a high five.
Yeah. Okay.
And we've done the Edinburgh course, actually trained to touch a target stick, so he didn't have to walk, I didn't have to pick him up and put him on the scales. Keep an eye on his weight, weighing him every month. So Yeah, I've done that as well. Yeah.
Yeah, amazing. You know,
Cat school has some really good, great stuff.
yeah,
Little bite-sized videos. I'm always mindful of, you know, that some of the jumping things. I think if you've got an overweight cat, just joints and things where you're doing that, making sure that it's on a soft surface, not, you know, avoiding those shiny surfaces.
absolutely.
Landing on joints and things. But yeah, I've done a couple of things. Yeah.
Oh, amazing. So yeah, you have to show me, because I that's one of those things that, you know, I think as an enrichment activity, particularly like if you've got young cats that are potentially having some intercat aggression, then making sure that they've got all of those outlets you know, for their predatory play and all of those things, and then actually getting their brain working and in doing those things would be great. I just yeah, so that's kind of how I approach those cases, and then, you know, try and see, really rule out physical, because I think for cats, you know, even with over grooming is another really common one that we would see presentation wise. And I think, you know, actually there's a lot of evidence to suggest that a lot of the time that is medical. So, you know, it's we used to quite often say, oh, that's stress, that's over grooming due to stress, when actually if we do a diet trial and supportive skin health treatments, so sometimes acting in the form of steroids, and, you know, that can obviously impact their behavior as well. But actually, if you can rule out any underlying reason for it and you do all of those things, then you're heading towards more of a behavior. But quite often those cases are showing us that there's a problem with their physical health. And so going through their history, seeing how regularly that's happened. And I think the overgrooming is another really key indicator as well for sometimes bladder upset. Okay, so the location where they're grooming is really, really important. You know, particularly if it's limbs, then that is a big red flag for me for osteoarthritis. But equally, if they're kind of constantly at their underbelly, like licking all of it, so that would, again, I'd want to go, oh, what's going on with their bladder? Is there something brewing? Have they got stones? Have they got any of these components that could be causing them to feel that much discomfort that they're constantly doing that? So with the over grooming, I would always kind of think physical until I've completely exhausted my list of medical differential diagnosis. Then I would look to more, okay, is this actually one of those rare cases where it is purely behavioural?
Yeah, yeah. And with things like around the litter tray with bladders, obviously looking out for changes in urine sizes, so really tiny bits of urine, obviously obvious stuff like blood in urine. That's why I really don't like these self-cleaning litter trays, because I just think you miss so many valuable things about your cat's health. But is there anything else that you can guide people towards in terms of changes in bladder habits?
Yeah, I think if sometimes it will quite often go with them drinking more. So you know, and again, if we've got older cats, so if we've got older cats that are starting to have issues around the tray, urinating, if they're going more frequently, if they're drinking a lot more water, then those two things, again, you'd be thinking, okay, is there something medical going on? Like, how are their kidneys functioning? Sometimes that can be a first sign of like hypothyroidism if they're eating loads, or that they might be diabetic, particularly if they've been overweight. So you would kind of, those again, sometimes because they're so, as caregivers, we don't want that. It becomes very obvious very quickly. So again, I think that there's always a potential medical reason for that outside urination, unless you've got something really obvious happening, like there's a neighborhood cat sitting right outside the window. And the litter tray is right there. If it's a gradual change, then I would be thinking that. But and then obviously it's important to differentiate between whether they're actually passing urine or spraying. If it's generally located near the litter tray, that's quite easy. But sometimes, you know, when a cat will suddenly start just peeing like near a door frame, it's trying to work out, actually, is that urination or are actually they scent marking? So that's important as well.
Yeah, of course. Yeah. So what would be reasons that there is scent marking?
I think you see that happen quite often in cats where they're concerned about their core territory being invaded. So if you are introducing a new cat into a household, then quite often it will be close to the points where the cats potentially haven't met yet, but they're kind of marking their territory as such. I think that's a common time that we see that. You know, if you moved house, I think that happens quite a lot as well. Changes in the home, new babies, people coming to stay, anything that makes that cat feel that their core territory is potentially under threat, I think you would then potentially see an increase in those marking behaviours. And I think the difficult thing with marking is actually, unlike inappropriate urination or lots of frequent urination, it's quite a normal behaviour for cats. They do that. You know, in their head, that's not that just because it's indoors doesn't mean, you know, and particularly if there's an indoor cat, so if they're not getting access to the outside, that is their boundary. And if something else is coming in that's causing them to feel under threat, then they're going to say, this is mine, you know? So I find those cases can be quite challenging at times, because from a welfare perspective, actually that cat is, you know, is performing a normal feline behavior. It's just not appropriate in the context that it's in. But yeah, stress can be a huge reason for that, because of like an external cat that's come in, or a change in family dynamics, or quite often new things going on in the neighborhood where cats are looking in, or sometimes, you know, if they don't have those microchip cat flaps, you've got cats coming into the house, and you know, how stressful would that be for a cat?
Eating your dinner. Yeah, absolutely. Yeah, you don't want a complete stranger in your house. Yeah, absolutely.
So,
I recommended some clients kind of pots outside, like big shaded plants outside the cat flap, so the cat can kind of survey the area before going out, making sure that there's no other cats there, or they can go back into their home if they're just feeling a bit nervous.
Yeah, absolutely. And I think it's a lovely way to be able to tweak their environment to make them feel safe at those kind of boundary points for their different core territory, you know, their different territory areas, because they've got their bit where they sleep and they eat, and they've got their little bit where they're external from that, where they go to the toilet, and then they've got their roaming range, which depends on the cat and depends on the environment as to where they're going. But I think they are such complex little creatures, and we just assume that they are fine, and a lot of them are so sensitive to such subtle changes that it can be really tricky to unravel. But by tweaking and ensuring you're kind of meeting those 5 pillars of feline health, again, that's on the cat iCat, and that's a lovely resource as well, like what they need. I think if you maximize that out, then quite often that will help. If it is purely behavioural and there's not anything medical going on, then that will really help your cat feel safe and secure, and all of those things that they need to then be able to go out and fetch a mouse and bring it back for you.
A present. Oh. Thank you so much. So Vicky, you're based in Northern Ireland, but you work online as well.
Yeah. Yeah.
So if you want to find out more about Vicky, please check out her website, www.vickythevet.co.uk. And thank you so much for your time, Vicky.
It's a pleasure, as always. It's lovely to see you.
Oh, thanks, Vicky.
Take care. Bye-bye.
Bye.